I turned 50 and I went to see my regular physician for my physical. And when I did that, he said, well, you've turned the ripe age of 50 and now you get to go have a colonoscopy. And so he said, you don't have to do it tomorrow. And I told him I had a lot of things going during the summer and different things like that. And he said, just do it sometime, when you get time, no big rush. So I set the appointment in September and canceled that one because something came up at work. And then I canceled the second one. And on the third time, I finally went and had my colonoscopy. And when I went and saw Dr. Patel and had my colonoscopy, of course, everything was fine and at first, and I thought I'd pass that with flying colors because I'd always been very healthy and not had any trouble. All my life, I'd only ever had my gallbladder out. I'd had children, and that was my big hospital experiences. And that day, when he came out of the colonoscopy, he told me that I could thank whoever sent me there for my life. And that's how I learned I had colon cancer. I did not have any symptoms when I went. I wasn't having any bleeding, any constipation. I was as healthy as anybody I knew. My doctor and I had discussed the fact that I was probably his healthiest patient when I went in to have my colonoscopy. Dr. Pfeiffer was wonderful. On our first meeting, he just asked a lot of questions, got my family history and my history, and told me exactly what I had going. They had found an 8-centimeter tumor in my colon. And he just told me that they were going to take a foot section out of the colon and resect it. Of course, he told me all the things that could go wrong and all the things that could go right, and just allowed us to ask all the questions that we had, and it was so personal and so calming. And when I left there, I knew, had a lot of peace from the Lord that was the right decision. One of the things that really stood out to me was he had this picture on the wall, and he took a marker and drew right on top of the glass on the picture and showed us exactly what he was going to take out the portion and how he would resect it back together. He was just so informative and calm about it all. And of course, I asked if this was the first one he'd ever done, and he said no, he had done a lot of them, and I was thankful for that. Very experienced and very sure of himself. I went in for surgery on a Thursday. It was December 13th, and had surgery that morning. And I was out of the hospital by Sunday, and that was really amazing to me. I was able to have it laparoscopically. That was the choice that I had requested because I thought that would be a lot faster healing and a lot less invasive, and they were able to do that. I knew there was a possibility they couldn't going into it, but it worked out really well that way. I can remember the nursing staff the day that I came in to have surgery. I had had my gallbladder surgery at Allegiance, and things had changed a lot since my gallbladder surgery. In the holding area before you go back to surgery, the nurses just told you everything that was going to happen. And I can remember being by myself when I had my gallbladder surgery, and that was a real hard time. There was like 20 minutes there, but this time it was just such a smooth transition. They just allowed my family and my friends to stay there, and then I don't even remember going to sleep. And then I had surgery and I came out, and the nursing staff was just wonderful. I had a couple of really good nurses that really told you exactly what you needed to do to get better and exactly how it needed to go. After surgery, I came to the oncology department here at Allegiance and saw Dr. Trimble, and Dr. Trimble spent about an hour with us just explaining all of the options that we had and how we had choices to make, and there was about a 1.8% differential if I had taken the pill form of chemo or not. So I decided to opt out of that and have routine colonoscopies from there on out. I would tell everybody the most important thing, or one of the most important things, is to get all of your routine visits done, whether it be a physical that you're putting off, a mammogram, a colonoscopy. Don't wait a day longer. Of course, I went back to my doctor and I told him, I said, you stop telling people that they can just do it when it's convenient, because colonoscopies are not convenient for anyone, and no one wants to go and have one done. But if you can catch it as a polyp, you don't have to have major surgery, and it's the time to catch it is early.